Okay, thank you, Dr. Siw.
Yep, this is what we are talking about, right? You can see the COVID-19 infection and pregnancy slide, right?
Yes, correct.
Okay, so we will proceed now.
Okay.
So, welcome everybody and to this seminar. Okay, now actually this so-called COVID-19 is still very new, right? And I'm sure everybody, I actually lost count how many days we actually locked down already. Yeah? Day what? I can't remember. Day 22, right? I'm not sure. Anyway, so I hope everybody is staying at home. You know, while during this time, we try to share whatever knowledge we can about this virus, and in particularly for my field, related to wellness and pregnancy. Now, bear in mind that this virus is very, very new. You know, it just over the past few months, there's still a lot of things that we don't know. A lot of research is still going on, and whatever I share now may change maybe in in a few months time, right? So we just go through it one by one. And if you have any questions, anything that you want to ask, you can ask me during the talk. You can send it over the chat, or you can after the session you can always ask me questions. You can ask me in English, Malay, or even Chinese, or whatever language that you want. Okay, we try to answer you. Okay, now COVID-19 and infection and pregnancy. Okay. Now, what effect does COVID-19 have on pregnant women? So maybe the crowd that we have is a different range of crowds. Maybe you are not in in a reproductive age group, but I'm sure you have friends or family members who are planning to get pregnant, or maybe is pregnant now, right? So you can share with them about all these things. This is this guideline actually is adopted by adopted from our Ministry of Health guidelines. You can access the Ministry of Health page to get further information as well. So in pregnant mother, what we know so far is that it does not appear to have higher risk of serious infection. So this is based on especially a lot of data from China, and we found that majority of pregnant mothers usually have mild to moderate flu-like symptoms. Now, you must understand that it doesn't mean that you won't get the infections, and doesn't mean that you won't get serious infection. We are talking about percentage. When we compare with older people, yes, the older people will get more serious infections, but doesn't mean that you wouldn't get, okay? So I think that's very, very important. As far as possible, try to avoid getting this infection is the best. Now, I think all pregnant mothers always have this very concern about their baby well-being, especially if they're infected with COVID-19. Yeah, I'm talking about patients with COVID-19 and if they're pregnant, right? So far, the data is not that big yet. We don't know. We need thousands and thousands of pregnant mothers, and then after that, when they deliver, then we know what is the. We will have more information about that. So far, we found that there is no evidence of increased risk of miscarriage in pregnant mother with COVID-19. And is it possible that, if you have COVID-19, can you transmit the disease to your baby in utero, that means during pregnancy? The answer is probable because they found, there's a few cases in Wuhan that they found actually they detected the antibody in the newborn. but they fail to isolate any virus from the baby. But bear in mind that all these baby, when they are born, they are completely isolated from the mother and from the environment. And they test the antibody, they found they have antibody, but not the virus. So we postulate that there's a probable possibility that there may be possible transmit from mother to baby. So any problem with the baby development, like I said, it's still a very new virus. We still don't know yet. Those newborn, maybe just a few months old, we don't know in the long term, right, effect. And because it's a new virus, is there any risk of causing premature labor, premature birth? It's still very, very unclear whether it's possible causing premature birth or not. Now, of course, in a pregnant mother, what can you do to reduce your risk of getting the COVID-19 infections? Of course, I think everybody know about this already, right? Wash your hand, and wash your hand. And of course, in the public, cough and sneeze etiquette. I think this is already become like a norm in our country. Everybody knows about it, what to do. And the most important, I think the best way to prevent yourself getting infections, stay at home, right? When you stay at home, you're helping us, you're helping yourself, you're protecting people surrounding you. So please stay at home. And I think this is very, very important. Like this morning, I read some news saying that those, in some country where there's lockdown, there's some young people going out and say, if I get it lah. It's my problem. I think it's a very selfish thought, a selfish thing to do, because it's not about you. When you're young, doesn't mean that you won't get serious infection. You will get serious infections. But the problem is you will transmit to people around you, even when you are asymptomatic. So that's a very, very important things, right? And then of course, social distancing is very important. And I think now in our country, it's very common. You see people wearing masks outside. I think it's a very good habit, a very good things to do. Wear your mask when you go out. And of course, boost up your immune system. This one I will share a bit at the end of the talk. How can you boost up your immune system? Now, how about your antenatal checkup? Now, I think because of this COVID-19, everything is changed and disrupted. The normal way of doing antenatal follow-up is already changed. I think definitely you have a new schedule of your follow-up, new appointment, and I think the most important is you make sure you're always contactable because especially if you follow up in government hospital, quite many of the government hospitals are converted into COVID-19 hospital. So definitely they will reschedule your appointment or channel your follow-up into elsewhere. And the way I think in the future, because of this COVID-19, the way of antenatal follow-up will change a lot. And now they will encourage you to go for your follow-up alone, to aid the infection control. And, to travel from your house, from your home to hospital also can be a hassle because of lockdown. So there will be a lot of adjustment. So make sure you are, updated. Make sure you are always contactable. Contact your clinic, contact your hospital, and find out what is the latest thing for your antenatal follow-up. Now, what do I do if I develop fever when I'm pregnant, right? So please always inform your health provider if you have fever, and especially during follow-up. Now, most important, you must understand that fever in pregnancy may not be due to COVID-19. There's always other causes of fever in pregnancy. And usually, we have to rule out other causes. For example, like the commonest one, like for example, urinary tract infections. These are the things that we have to always rule out. Yeah. So if you have fever, contact your antenatal clinic. And if you have other symptoms of COVID-19, definitely they will test you, right? If the test come back to be negative, right? Usually you will continue your management by the ONG people. But if it's positive, definitely you'll be admitted to the designated hospital, and will be managed by all these COVID-19 infections hospital. Well, if you are infected, do you need special monitoring for the baby? So far, there is no evidence that we need to do extra testing or extra monitoring for your baby. Is just like your normal routine follow-up. For example, during your second trimester, you need to scan for fetal abnormalities. Yes, they will continue to do that. In your late pregnancy, you still need to monitor your fetal movement. You go to hospital, we will still do the cardiotopography for you, the CTG, and we still do the ultrasound as like normal. Now, do you need to stop your supplements during pregnancy? If you are infected during pregnancy, the answer is no. You should continue taking your supplements. And I think it's well known that NSAIDs like all these Warren, all these Voltaren, Profen will aggravate the disease. So these are the things that usually we have to avoid. However, if for whatever reason you need to take low dose aspirin, because aspirin is one kind of NSAIDs. You need to take low dose aspirin for some reason, for example, for prevention of preeclampsia. Preeclampsia means severe kind of hypertension in pregnancy, right? You have to continue your low dose aspirin. The experience now up to date is safe to take low dose aspirin in pregnancy. Okay, sorry. Now, what happened if you have premature labor? Now, we know that those patients with premature labor, we use corticosteroid, to enhance the lung maturity of the baby. Now, there's always concern using steroid in infections, especially viral infections, bacterial infections. And in COVID-19, so far the recommendation is that if you are less than 34 weeks, it's safe to use the steroid during that time, because we believe the benefit is outweigh the risk. Now, how about borderline prime, 34 to 37 weeks? It's still not clear, and I think it's up to the individual doctors. And a lot of center they avoid using steroid during this time. And what happened? Let's say unfortunately you're down with COVID-19 during pregnancy, and you are in third trimester, nearing your labor. As far as possible, we will try to delay the labor until the infections settle. Now, if you have fever and cough and then you are in labor, please inform your doctors that you have these symptoms. It may not be COVID-19, but we have to, by doing that, you're helping us to prepare the team, your obstetric teams, to make the appropriate preparations. And you know that if you are in COVID-19 patients, if they're delivered, they need to deliver in a special room, and all the medical personnel, you need to wear the proper PPE. And during labor, the intrapartum monitoring is just like any normal patients. And just that we don't encourage to use Entonox, the gas, laughing gas, or for your pain relief. The rest of the pain relief is okay. Now, how about mode of delivery? Um, the current recommendation by our Ministry of Health is routine lower segment cesarean sections. The reason is to control the infections. Now we know that maybe all the guys don't know, but I think if any ladies who have delivered baby before know that the the labor process is long, is painful, is exhausting, right? And if you are down with COVID-19 infections, your lung may be compromised, and we worried about the longer the labor, the more disseminated the virus is, and even you may not have the strength to push. So that's why the Ministry of Health recommend routine lower segment cesarean sections to control the infections. Now, how about postpartum care? How about breastfeeding? If you follow CDC, they recommend continued breastfeeding because so far we haven't discovered any presence of virus in the breast milk. However, for logistic reasons and isolation reasons, because most of the time the baby is, will be on isolation from the mother who have COVID-19. So the Ministry of Health have suspended the baby-friendly policies at this moment. So, well, I think we have no choice, because we also worried, right? I think the mother is also worried whether she will spread the infection to the baby or not. Okay. So what is the prevention strategies? This just share a bit, about what you can do. I think this is all overlap, right? We already say about this already. Your cough and sneeze adequate. That means you have to change your behavior to face this, COVID-19 infections. And one of the things that very difficult to do is avoid touching your face. I think we human beings always like to touch here, touch there, right? And I think over the 1 hour during this conference, I'm pretty sure that I myself will touch my face at least 2 or 3 times. So, but I think we have to be more mindful about this now. Again, social distancing, hand washing, and stay at home. Okay. Now, how do you boost up your immunity? Make sure you have enough sleep. Now, okay, sleep. Too little sleep, too much of sleep is also not good. I think in any adults, any pregnant mother, 7 or 8 hours of sleep is good enough. Yeah, and because during sleep, you actually all your body are recovering, your immune system are recovering and boosting up. So that is the best time, to for your immune system to work. Of course, exercise. Now, a lot of people, during pregnancy, they worry about exercise. Actually, we encourage patients to exercise during pregnancy. Listen to your body, doesn't mean that you have to do hardcore exercise. Sometimes during pregnancy, do a bit of stretching, brisk walking, is good. Of course, during lockdown, it's very difficult for you to go out and do your brisk walking. Well, walking around your house is okay. Walking up and down the stairs is okay. But just listen to your body because during pregnancy a lot of changes. Your joint, your ligament, your muscle will all have a lot of changes. Your ligament tend to be a bit lax, so it's quite easy to to have joint pain and things like that. And then the weight changes. So do exercise according to how your body is telling you. So don't overdo it. Now, stress management is very important. Now, pregnancy itself is already very stressful. Well, I think during these times, support from the husband is very, very important. Support from the family, will be helpful to help to overcome whatever stress, anxiety, or depression that you may face. Do some reading, some breathing exercise, yoga, maybe. this all will be very, very helpful in your stress management. Because we know if you have a lot of stress, if you have a lot of psychological problems, definitely that will bring down your immune system. And from research, it's already proven that those who have a lot of stress or depressed patients are prone to infections. So that's why it's very important to manage your stress appropriately. Of course, eat nutritious food and diet. Eat more vegetable, more colorful vegetables, more fibers, and try not to eat too much of processed food. Right? I know that it's very difficult now, lockdown. You cannot go out to eat the food that you like, and a lot of time people go just make it easy to order fast food, right? Well, maybe this is the best time since the lockdown. Try to cook some, uh, do your own cooking. You can follow in the YouTube way to cook whatever style that you want, but bear in mind, eat a lot of vegetable. Try to cut down your sugar and things like that. I think later Dr. Chua will share a bit more about diet and food and supplements. Well, let me talk more about supplements. Now, I think during pregnancy, I routinely give my patients folic acids, hematinics, and fish oils. Now, all these supplements are important supplements during pregnancy because they will. We know that if you, for example, like folic acid, especially early pregnancy, that will help you to reduce the risk of fetal abnormalities, and your hematinics. You need the iron because you know that during pregnancy you're prone to get anemia or not enough blood, right? And then fish oil, I encourage my patient to take fish oil because the baby is growing, the brain is growing, and especially the DHA component in the fish oil that will help the baby brain development very, very good. Now, because of this COVID-19, I will advise my patients to add on if they want, you know, uh, vitamin C's and vitamin D, because all these two is proven, especially from the Wuhan experience, can really, really help to fight these infections. Now, vitamin C is water soluble and is very safe, and you can take very high dose. And in fact, we even encourage, now, especially now, you can take vitamin C up to 1 to 2 grams twice a day, right? And if you are down with COVID-19 or even any flu or any infections, you can even take it more frequently, every 2 to 3 hourly, 2 grams every 2 to 3 hourly to help you to accelerate healings. And vitamin D, even though, we have a lot of sun in our country, but surprisingly, majority of our populations lack of vitamin D. So, and vitamin D is very, very good for antiviral. So, and I encourage you to also top up or add vitamin D into your routine supplements during this pregnancy. Okay, so I think that is all about my sharing. We can, if you have any questions, you can about pregnancy with COVID-19, you can ask me now if you want, or you can ask me at the end of the sessions. The next session will be shared by Dr. Chua, and I think I pass it back to the MC and see what's the flow like. Whether we continue with the slides or Q&A first. Up to you, Julian.
Yeah. Okay. Thank you, Dr. Siw.
Can you see the slide, Julian?
Yes. Can see.
Okay. I think Dr. Chua, you have to unmute your mic.
Hello.
Yeah. Hello,
Okay.
Dr.
Can
Chua.
you hear me?
Yeah, can hear
Yeah,
you.
we can hear you. We
So,
can you can
yeah,
proceed.
so you may start now.
Okay. Hello. Good morning, everyone. Hi. Thank you so much for tuning in and joining us for this mini seminar. So today I'm going to share a bit on the COVID-19 in children. This is COVID-19 is something that's so new, right? So it's actually something that is that started in China, and now it's spreading all over the world. So the best experience that we have is actually from China. Yeah. Next. So where the epicenter of COVID-19 started. So this study was this is a Chinese experience. Um, this was done by the China CDC, where they studied over slightly more than 2,000 children with COVID-19 during a 3-week period, yeah, from mid-January to early February. And most of them, as you can see, they're from Hubei. Slightly more boys are affected than girls, though not significant. And the ages are actually from 1 day to 18 years. And so if we look at what we're interested to see is actually what happened to those children. We can find that about 94% fall actually under the asymptomatic, meaning they have been tested positive but no symptoms at all. Or mild, they are also tested positive, and they just have fever, cough, running nose, sore throat, a bit of body ache, sneezing, just like any other viral infection. And then the moderate ones are those who had pneumonia. All right, but they were still quite well. We want to next. So we want to look at this group of about 6% of them who actually fell under the severe and critical stages. By severe, they mean pneumonia with shortness of breath, requiring oxygen. And those who were critical, they actually went into the ARDS, yeah, where they had severe respiratory distress with respiratory failure, and also organ involvement, the heart, the kidney, yeah, and those were life-threatening. So as we can see, infants are actually the most affected groups. The most affected group is actually those below 1 year, and then the rest of them. And actually one child died, a 14-year-old child died. So next. So the message that I want to convey to you is that children can be affected, and particularly the infants, they are at risk of severe infection. The severity, thank God that severity of children are much milder, and so the importance of this is actually that to realize that children are more likely than adults to spread the disease because their symptoms make them difficult to identify. So really have to keep our children away from the at-risk people, especially those who are in Malaysia, especially those who are more than 50. Yeah, because the severity to those who are older are definitely much more higher. And so now let's move on to what do we do with this COVID-19? As we know that COVID-19, there's still no proven treatment. Yeah, there's no treatment has been proven effective and approved by the FDA, and there's no vaccine as yet. So the best thing to do would be, logically, to suppress the reproduction and spread of the virus, and because in this condition, the host factor is very important. Yeah, You all heard about the cytokine storm. So this is like the reaction of the body towards the infection. That is the one that actually killed the patients. So so let's talk about a bit about this. Next. Okay, how do we suppress, control the infection or the spread of the infection? We hear this, yeah, almost every day. It's everywhere, on social media, on TV, on our WhatsApp, yeah. So we really got to take this seriously, because believe it or not, the actual frontliners are actually all of us. According, quoting Dr. Michelle Au from New York, the actual frontliners are really us. And the healthcare people, they are the last defense. So we can prevent the infection. It really is going to do the whole world, very much favor. So social distancing, at least a meter, if possible 2 meters is even better, because it depends on how the droplet, or it's been produced. Someone is shouting or singing, these droplets can actually travel further than 1 meter, go 2 meters or even further. When they sneeze and cough, this actually gives the droplets extra energy, and they can actually travel very far away. Frequent hand hygiene, you're asked to wash hands, so yeah, just use a normal soap will do. You don't have to get the antibacterial hand wash, just a normal soap will do. And by this time, I expect most of you would complain of dry hands. If your hands are still very nice and moist, means you're not doing enough hand washing. Yeah, get your children to practice that too, because children, you all know, they actually practice what they see more than what they hear. And so we have to set good examples in all this, yeah, social distancing, hand washing, sanitizing if we need to. We can play games with the children, and sing songs with them to educate them on how long they need to clean their hands and wash their hands. And then, of course, when we cough and if you're coughing, you need to use tissue or wear a mask if you can. Avoid touching your eyes, nose, and mouth. We know that normal person would touch their face about 23 times in a day, 24 hours, yeah. So and some people may probably do more than others. Self-quarantine if you're unwell, seek medical help. If you have any symptoms that may suggest how do they manifest stress, yeah. So some children may actually voice it out, and they'll tell you, Mom, I'm worried, Dad, I'm scared, but sometimes they don't. And so we need to recognize some of the common features of manifestations of stress. It could be changes in their behavior, changes in their normal habit, things that they like to do, they stop doing. It could be increased crying. They just they cry more than usual. Sometimes it could be throwing of tantrums. It can manifest as suddenly they complain of headache, suddenly they complain of stomach ache, and different children may manifest it differently, and sometimes they start to pick up new habits like thumb sucking, so these are some of the things that we need to look at. Yeah, sometimes they can't sleep, insomnia, which is also one of the signs of stress in adults. Next. So what do we do to help them? How do we help them actually? So first of all, is actually to recognize that, you know, that this COVID-19 is a stressful situation. I mean, it stresses all out, and I'm sure it will cause so much, changes in our lives. So definitely, and when there's any change, it's going to bring about stress. When they don't go, they are not able to go to school. They miss their friends. They are no longer following some kind of routine that they were so used to. So these are some suggestions that hopefully may be able to help you to help them. We have to stay calm. All right, we have to stay calm and imagine ourselves to be in their shoes. Sometimes, that is the best way to have empathy, to actually walk in their shoes, in somebody else's shoe, and so that we can have some idea what it could have been like in their life. So stay calm and don't and keep a sound mind to think of how we can help, and then try to create some kind of routine in spite of this this time when there's no routine, no more normalcy in our daily life, because there's nobody to tell us to keep to a certain routine. So we can create a routine at home. Yeah. So as for the sleep, yeah, you can actually, both parents can actually decide on the time, bedtime, and then from there, then what time they're supposed to wake up in the morning, and then what happens when they wake up in the morning, what do they do, and then you sort of give them some kind of timetable to follow, because children, that gives them assurance, that they don't have to, because whenever there is any instability, anything that goes out of routine, they get very scared. They feel out of control, just like us. So we can help them to set that, new times, etc. And then it's also equally important that when we do that, we follow their pace, because time is relative, all right? So for children, their clock moves slower. You don't hear a child telling you, how come time is moving so much faster now than before? They don't say that, okay? But we do, because we're getting older. So as a child, their clock moves slower. So we have to allow that, because they need time. The maturity of their psyche, it takes time. So even like if they are still in the preschool age, they still live in a world of fantasy, and logical thinking comes about say in their school going age, from 7 years onwards. So we have to allow that in dealing with them. And then I think it's very important to monitor the media that is bombarding them and us every day. If we switch on the TV, it's most of them talk about this COVID-19, and it will affect the child in a way. So I think we should monitor the media. If we hear too much of bad news, then our worldview will become negative. So do they. When we as parents, when we talk a lot of bad news, it will also affect the child. So be careful about that too. And then I think more than ever, because we are now confined in our homes, we need to show more kindness, more love to people around us, because everybody is stressed out. And so get to know your children and also your spouse, everybody in the family, because this is important. The harmony in the family is so important. So some love languages, some people they value time. They look at time spent with them as a love language. All right, if you spend more time with me, you love me more. Some people, they may want you to give them something, gifts as their love language. Some maybe words of encouragement. Yeah, so get to know your family members, and we must make something good out of this this crisis that we are facing. That love will grow in our family, and we all pay more attention, yeah, to each one in the family. Next. Okay. Okay, exercise. So I think what's important is to childproof your home. Make sure it's a safe environment, yeah, to especially to do some indoor exercises. Remember, to a child, play is a form of exercise. So just let them play. Just make sure it's safe, all right? And play with them. We used to say we do not have time for our kids, and now is the time to make up for that. All right, look at it as something good. This crisis as something that we can make something good out of it. So knowing that exercise will improve circulation, not just the blood circulation, also the lymphatic circulation, which is important in our immune system. So children, they are advised, the preschoolers are advised to have like 2 hours of play exercise in a day, and the older ones can probably about an hour. And so parents get involved, all right? It will help, definitely help. Next. Okay, and this is the talk about food. It's also, as you can see in your WhatsApp, most people would like to post, how they're trying out new recipes and things like that. Just a reminder, a kind reminder, try as far as possible to make sure the food that you're eating is functional, meaning not just taste good, it's also nutritious, all right? As far as possible, try to go for natural food. Make sure you have some natural foods, all right, in your daily diet. By that, we mean, make sure you get good proteins, complex carbo, and also healthy fats. These are important too, because they are the building blocks to our immune system and our body. And then the micronutrients are equally important. The vitamins, the minerals, phytonutrients. Phytonutrients are the colorful nutrients that you get from the colorful vegetables, especially, yeah. And then cut down on sugar, all right. Those only produce empty calories, and especially the high fructose corn syrup. These are not good for us. Next. So I just want to quote a study. This was done in 2013, CNUTS. This is the first CNUTS in Malaysia. Just to show you malnutrition in Malaysia. Vitamin A deficiency is about 4.4%. You'll be surprised that vitamin D deficiency is so high, 47, almost 50%, despite us living in a tropical country where we get sun almost every day. Yeah, iron deficiency is 4.4, anemia 6.6%. And then, of course, the other problem of obesity and overweight and obesity. and then the other end of it, the underweight and stunting. So these are you know, facts about our Malaysian children, fortunately. And we're waiting for the next CNATs, right? They're still doing the study, still ongoing, the CNATs too. I want to see when it's out how it compares to the first one. Next. So I'm going to discuss briefly on the vitamin D deficiency, all right? Because this is very important. Now, we know more and more about vitamin D now than ever before. Last time, people always talk about rickets, prevention of rickets, right? But vitamin D is actually more than just preventing rickets. And the amount of vitamin D that used to be, you know, said optimum for us was actually for prevention of rickets, all right? We know now that we actually need more vitamin D than that. So vitamin D is important modulator of the immune system, meaning it actually regulates our immune system. Meaning if you need more of you know, cytokine, for example, or whatever, you know, it's able to do that. So a deficiency in vitamin D will make one more vulnerable to infections, especially the respiratory infections. It has been shown that vitamin D was able to reduce influenza by about 12% in the study. So most of the time, vitamin D deficiency requires supplementation, either in the form of drops or capsules, or sometimes injection, if it need to be, sometimes in certain people who like a boost in their vitamin D level. So you probably would ask, why are we having vitamin D deficiency when we have the sun all year round? So in order to answer you, okay, just want to tell you briefly about how vitamin D is being produced in our body. All right, we actually need the ultraviolet B, UVB, for that, for vitamin D production, and so anything that blocks the UVB will definitely block the production of vitamin D. So if you wear sunblock, anything that's more than 30 SPF, you won't be able, your body will not be able to produce any vitamin D. And then you need to be adequately exposed. Yeah, if you cover up, you know, like our Muslim friends, because of religious requirement that we need to cover up most parts of our body, then you're going to have the vitamin D deficiency. So most of us, anyway, we don't go out to the sun anymore because it's so hot, and also it causes premature aging. So the other thing is, you know, even the sun that you go out to, if let's say you are being, you know, if you stay within a glass window in the car, the glass will block the UVB 100%. And if you are under a shade, it's the vitamin, the UVB is cut by 60%. And if you if let's say there's cloud, yeah, over the sun, it cuts the UVB by 50%. So so having said all that, so if you're able to, if you really want to make vitamin D, then you have to go out for at least 30 minutes between 10 a.m. to 3 p.m. sun, you know, adequately exposed. Or you just covered your trunk, and the rest of the, you know, the face, the hands, and the legs has to be exposed, which is why this is a problem everywhere in the world, vitamin D deficiency. So with this I end my presentation. And so if there's any question, then we can actually discuss about them in the Q&A. Thank you.
Okay, thank you, Dr. Chua. So can I remove this slide? Yeah? Can someone help me to remove this slide? So now I would like to see Dr. Siw's face as well. So maybe can go back to the previous setting.
Can see me? Cannot see.
It's not like this because you know, like the past few days also we have the in column one we have few person. That's why I can see you both. Now I can't see. I can only see you or see Dr. Chua.
I think Chua, Dr. Chua had to press on the show thumbnail video, I think.
Yeah. Is it?
I don't know whether she knows how to do it or not. Okay.
Okay, I think
I think you can control, right?
Can
I
see
think the host
already.
can control, yeah.
Yeah, no problem already. Okay, so is there any questions, anyone? You can just post out a question by chat or you can just raise up your hand and we will unmute your mic. Okay, so just now we are talking about the pregnancy, right? So Dr. Siw, actually how to take the precaution during the pregnancy confinement?
I think during confinement, in Malaysian setting, if you are a COVID-19 patient, right? Once you delivered, after delivery, they will straight away send you back to the designated hospital. Okay, so I'm talking about COVID-19 patients. So I think maybe this is a reminder, maybe just sidetrack a bit, reminder for all the listeners, to everybody outside, why is it so important to stay at home? Because you must understand, once you are infected with COVID-19, right, you will be taken away to the hospital. There won't be any relative sitting next to you, holding your hand, asking you, how are you okay, feed you or things like that, right? And you won't be able to, go out. You stay in the room, isolated, right? And if you are, if you are so unfortunate, very, very sick, nobody will come and visit you. You can't even call your family members. You can't even text them. So it's a very painful and lonely disease to have. So especially, this is just a reminder for those feel that they are so strong and won't be able to, the virus won't be able to infect them. Please help us to help yourself. Now, in the postpartum period, well, in our country, it's very straightforward that you have COVID-19 patients, straight away they isolate you and the baby, and they don't encourage you to breastfeed. In some country, yes, they allow you to breastfeed, but you have to, every time breastfeeding, you have to, the same precaution, you have to wash your hand before you hold your baby, you have to cover your face, with mask, everything, right? And, when you breastfeed your baby, immediately after you breastfeed your baby, you have to return baby to isolation, and then you have to wash your hand again. This is the way they do it now. But in our setting, it's very clear cut, up to date. The Ministry of Health actually discourage, a mother to breastfeed. So I think the postpartum period, the standard precaution is the same. Anyway, if you a lot of Malaysians during postpartum period is like a lockdown anyway.
Yeah.
Right. So I think lockdown is for those who have experienced postpartum before, lockdown is nothing. Right. So it's just a standard. I don't think you have any changes. In terms of supplement, it's still the same. We still encourage you to continue your supplement even though you already delivered. I think during the chat just now that somebody asked about, fish oil consumption during pregnancy. Now, during pregnancy, the difference between non-pregnant mother and pregnant mother is that because during pregnancy, you have a baby growing inside you, and this baby, we as a parents, we always want the best for our baby, right? And we know that during one of the part that we always want our baby to be smart. So in other words, the brain development. So in order to have optimal brain development, you need especially DHA. DHA is one kind of omega-3, right? And the requirement, usually the recommendation is about 200 milligram to 250 milligram a day. Now, if your standard fish oil doesn't contain enough DHA, then you can go and buy those specific fish oil for pregnancy. They have it outside in the market, but that's a recommended dosage for baby in terms of fish oil. For normal people, I think I shared the other day during the first session that for normal to maintain our health, cardiac protections, immune system boosting, you need about 2 grams of omega-3 in a day. That means your DHA and your EPA combined together must be at least 2 grams in a day. So that's the recommendation. Okay.
Okay, thank you, Dr. Siw. Actually, is it possible of getting infection during the process of delivery? And the symptom comes out during confinement or after?
Anything is possible. Okay. So I'm not so sure about the first question. Is it saying that is it possible for during delivery you pass the infection to the baby?
Yeah. No, like the pregnant woman getting infected, got infected during the process of delivery, and the symptoms come out during confinement or after only.
Okay, I think, can you get the infection during delivery? To be honest, we healthcare are more scared than you, more scared than, more worried about you passing to us than we passing to you.
Okay.
And COVID-19 has changed the healthcare system completely. Now for normal delivery, if you don't have any symptoms suggesting that you have COVID-19, then usually the normal delivery process will be the same. That's why it's very important for you to be honest and truthful to us. We trust you guys, we believe you. You tell us that you don't have fever, you don't have things, blah, 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 all this, we believe you. And in a normal labor, we will still use standard precaution. That means we still gown up, we still wear masks, just that we are not in full PPE in the normal delivery situations. But if you, for whatever reason, you are a COVID-19 patient, you will deliver in a special room. Special room means negative pressure rooms. Means all the air inside the rooms are actually sucked and they don't spread to the surrounding area one. And all the health personnel will be wearing full PPE. And in all the designated hospital, they have team, ONG team, ONG doctors. They mean the whole team, the nurses, the obstetricians, the anesthetists, just to handle COVID-19 patient. That means you are COVID-19, you deliver, this team will handle you. Because we need the other team, the rest of the team, to handle the normal patients. So yes, of course, if you ask me, is it possible you can get it from us to you? Yes, possible. But the risk will be very, very low because all of us will be gowned up. We'll be wearing masks, we'll be protected, we'll be wearing gloves and things like that. Same thing. During postpartum period, you still have to observe the COM. You still have to stay social distancing. You still have to what do you call that? Stay at home. And of course, if you are not you think that you have no risk of exposure to COVID-19, we still encourage you to do the normal rooming in, breastfeeding, stay with your baby, all those things. In a normal patient, it's just like normal. Now we just worried that you have COVID-19, okay? So no changes for normal patients. Don't worry, okay?
Okay. So actually, can a mother, what if she got the COVID-19? Then after recover from COVID-19, can she breastfeed her child?
Yes, of course, definitely. Even you have COVID-19, like just now I shared, even some country, they encourage you to breastfeed. If you are, that's why, let's say if you are at third trimester going to deliver, as far as possible, if you have COVID-19, we try to delay the delivery until you recover. Until you recover. That means, for example, let's say you are 9 months pregnant, right? Okay, you're going to deliver soon. We don't purposely go and induce you, if you have COVID-19, we don't purposely go and induce you, make you go into labor. In other words, we will try to let you recover from the COVID-19 infections. Then for whatever reason, then only if you need cesarean sections, then only we do the cesarean sections after that. So in other words, we put it a simple way, we try not to deliver a COVID-19 patients.
I see.
We try not to deliver you while you're having the COVID-19 infection. We try.
Okay.
Yeah.
But
So,
what will happen to the baby in the stomach?
I mean, you're not in labor. I'm talking about patient that is not in labor yet.
Yeah. But what will happen to the baby? Because it's overdue.
Of course, let's say in other words, if there's a reason to induce, you have to induce.
I
see.
So as long as it's not overdue.
Yeah.
Correct.
So in other words, we deliver you depends on obstetric reasons, not because we induce you because, or we deliver you because you have COVID-19 infections. So in other words, everything based on obstetric reasons. And the monitorings, everything is the same. How we monitor you, whether you're infected or not infected, is the same. It just said everything, because of the infection, you will be in a very special room, So these are the things that we have to totally different from the normal practice now.
Okay. So, Dr. Siw, does it affect the emotion of a pregnant woman or a mother after delivery because of over worry?
Pardon again?
I mean, does it affect the emotion of the pregnant woman or a woman after delivery because of over worry?
Yeah. Of course. Now, like I said, pregnancy, delivery, having a newborn, all are stress.
Yeah.
Right.
But
Before
now,
COVID-19 is already stress. Now
yeah,
even
and
more
now
stress.
it's with that's
Yeah.
why.
So definitely everybody will be affected, right? That's why I say just now, stress management. I think in this part, as the husband, right? This is the best time for us to, at least be there to give the support, for your wife. Definitely, of course, we will see. Well, there's no data yet, right? Whether postpartum depressions, postpartum blue is more common among COVID-19 patients or during this time. We have no data yet. But I wouldn't be surprised if this is more, because we have more things to worry, right? Lockdown, MCO, no work, no income, all these are, and then new baby coming, more, financial stress. Definitely there will be more psychology and mental health issue. That's why I think the Ministry of Health also stressed in a guideline that we have to be more aware of this mental health issue during this period, and refer our patients to appropriate, medical personnel if they need to. The Ministry of Health already anticipating we have more of this mental health issue. during this time and also post-COVID, right? So, of course, we will encourage the patient to voice out. You know, you have really have, I think, but just by sharing, at least you feel better already, right? So I will encourage all the patients, the pregnant mother, the expecting mother, you know, when you have this mental health issue, please say it out. You know, we will try to help in whatever way we can, right? Even though it's all the inconvenience of moving around to the hospital, but we will try our best. Okay.
Okay, thank you, Dr. Siw. And Dr. Chua, actually, how to make sure the kids follow the ways of self-protection? Once they go to the school, maybe they see their friends and they will just forget everything. Yeah, after the lockdown. Yeah, can you hear me?
Unmute. You need to unmute first, Chua.
Hi.
Yeah.
Hi, can you hear me?
Yeah.
Yes, we can hear you.
Yeah, that one is a you know, has been a big concern. Even before the lockdown, when we have cases, we have some cases in Malaysia, and then everybody was so frightened, yeah, and then you know what to do in schools. And so when the schools started to report cases, yeah, in their vicinity, and then one by one, you know, we hear of schools affected. So one thing about children is that you know, they can learn, and they learn pretty fast, sometimes faster than us, yeah. And I think more than ever this time, we need to really educate our children well, and teach them, and train them, because it's something that is new. Most of us do not wash hands as much as we used to, right? Even now, and we don't have the proper cough etiquette before. I mean, most people don't. And so these are all new habits that we need to learn. Like these are the new normals. And children, they will pick them up very fast, faster than us actually. So with time, we just need to give them time.
Okay. So actually, what kind of food or diet do you suggest to prepare for the children to boost up their immune system?
I like I said earlier, go for natural food. You know, try to, you can actually divide your food to, you know, the natural, and then those that are minimally processed and that are totally processed. And they're totally processed, you don't even know what it looked like before, right? So like for example, you look at chicken, and then you look at nugget, you don't even know that it came from chicken, right? You don't even know, and there's so many things added to it, and so we need to know the if it, let's say it's you know, really chicken and not like nugget, it has a combination of many other stuff inside that we do not know. So then we want to make sure, because we want to make sure we get good protein, yeah? Or vegetable as well. So meaning try not to go so much for the the pre-packed food that you know, that you buy from the supermarket. But at this time, I know it's difficult, but it's also time when we kind of encourage our children to go more for vegetable, plant-based food, yeah, because we also need to overcome the problem of obesity and overweight in our population, because obesity, diabetes, cardiovascular disease, hypertension, now all these are going to, they are actually, as you can see, they're risk factors for a more severe infection in the COVID patients. So, or severe outcome in the COVID patients. So we don't know how long this COVID-19 is going to be, but whatever it is, we want to start, if we can, even now, to start inculcate healthy eating habits. And I think this is also a time and we can actually teach our children and involve them in food preparation. We can teach them how to cook simple meals, yeah, simple but nutritious.
Okay. Then, okay, one more last question. So what kind of environment can parents prepare for their children to make sure they are safe? Yeah, they are safe from the COVID-19. What kind of environment?
Staying at home is a good advice. Means don't take them out. Because this is going to change the way we live. All right. For the time being, the best thing to do is stay at home, and then teach them about hand hygiene, the proper way to cough and all that, and also to follow whatever advice that from the health authorities, yeah, until we know more and more about this COVID-19, you know, and we hope that we will discover more, because I believe in our science and technology is really advanced. Yeah? Because like at one time, you know, during the SARS, it took us quite some time before we know the virus. But this time, when it comes to COVID-19, China was able to come up with the genome of the virus within a short period. So with the advancement of science, we are looking at, you know, hope. There is hope, and I think more than ever, giving hope to your children is very important, because we want that positive environment. And also, yeah, going back to the food, yeah, one of the things is from the vegetable, a simple way is actually to go for the different colors of the food, different colors of vegetable. Try to go for different colors every day. Of course, now we may have limited choices, but try, you know, get the ones that are red color, green, the yellow, orange, purple. Yeah, get them into the diet. Make your table, your dining table look as colorful as possible.
Okay, thank you, Dr. Chua. And anyone else would like to raise up a question? Or Dr. Siw, do you have anything you want to add on?
Yeah, I think to summarize the whole thing is, the best thing is still try to avoid yourself becoming one of the statistics. Okay, I think that's the best, right? So that you don't get infected. And of course, in terms of supplement, I would like to recommend, you know, add on to your vitamin C and vitamin D, right? You can get it from your pharmacist. Yes, you can get it. You try to get it. If you cannot get it, you can always contact us. We will try to, you know, supply you the supplements.
Yes.
Okay.
Okay. Okay, thank you, Dr. Siw. Okay, so here comes to the end of our online seminar for today. And don't forget that tomorrow we still have 3 more sessions to go, okay, in Mandarin. So once again, thank you very much, Dr. Siw and Dr. Chua, for your sharing. And thank you, everyone.
Thank you.
Yeah. Have one raise up hand. Okay. Wait. Who raised up hand? Okay, Jojo. Jojo got something to ask, right?
During this MCO, if we go out, should we use the car aircon or wind down the window?
I think to use aircon or open up the windows and let the natural wind and things like that. I think most important is yourself, you see. If you are not a COVID-19 patient, you don't have any symptoms, it doesn't matter you on the aircon or you open the window, right? But of course, logically, if you are not a COVID-19 patient, right, I would say, you know, using the car aircon is safer than expose yourself to the outside wind, right? But if you are COVID-19 patients, right, okay, if you see, I think if you sit together inside the same car, that would be, honestly, is very, very, very risky, right? Right. So in those environment, in those situations, I think the standard things that you need to do is, even let's say sometimes we cannot avoid, right? For example, when our family members down with the infections, we need to send them to hospital, right? We have no choice. So in whatever way, whatever situations, the standard, the basic guideline is still the same. Wear your mask. Wash hand before touch your relatives who are sick. Wash hand after you touch, before you touch anyway. Okay? If you have those disposable gloves, wear it. So maybe in that situation, it's more logical to, when you send them to hospital, open up the window, right? Instead of in the aircon, inside the aircon environment. And then after that, you have to clean your car after you send them. So all these are basic, basic things that you need to do. Okay.
Okay, thank you, Dr. Siw. Okay, so I think no more questions. So once again, thank you very much, Dr. Siw, Dr. Chua, and all the attendants for your precious time. And if you have any more inquiry, do not hesitate to contact our doctor, Dr. Siw and Dr. Chua, or Stella Clinic for further consultation. And don't forget, tomorrow we still have 3 more sessions to go in Mandarin, which we're gonna to share on 内外兼顾关爱自己，你学会了吗？新冠肺炎战役，孕妇和儿童如何提高免疫力 ？And also 抗疫靠自己强大免疫力才是王道。So if you like our sharing, please share to your friends, your families. Invite them to join us to learn all this together with our professional doctors. And once again, I have to remind you, again, have to wash your hands frequently, wear a mask wherever you go, and be safe, be good in MCO. And I will see you guys again tomorrow. Take care, everyone. Have a nice day. Bye-bye.
Bye-bye.
Bye-bye.